very, very informative. And so even before, we continue to dialogue with you, I will tell you, today is a day to take notes. So today is a day to get a pen and a paper or book and take notes. We are going to teach you. We're going to be very slow in the sense that we will make sure that the information that we give in, you can really absorb and take that information, because guess what? It may be very, very applicable to you at this time. Let me say good morning to my co-host, Trudy Christian.
Good morning. Good morning,
Trudy,
Carlton.
I love your blouse. I really love that blouse.
You
I
love
wouldn't have mind a shirt.
like that.
Yeah.
Okay. So we have to get the male version
Yeah.
of that fabric,
I would
of that
rock that.
shit in that fabric.
That
Yes,
would
yes.
look very nice in a nice chocolate brown
Bottom.
bottom. Khaki.
Good morning, Carlton. Good morning to the listeners of Q95 Radio and, of course, of Health Vibes. Of course, happy to be on once again. Carlton, I don't know. It seems to be a very quiet morning in the studios of QFM. I don't know why. I don't know why. I don't know what happened before we came on, but it seems to be quiet. I don't know what's the vibe you're getting. Yesterday was a very rainy,
Yes.
stormy day.
Yes, it was.
I don't know if people still recovering from the activities during the rain, but it seems to be a quiet morning. But it's a nice morning.
Quiet is good, you know.
Mhm.
I that's why I like rainy weather, because I think it really find a way to sort of debrief and calm down. It has a way of calming down your emotions and your nerves. Hot sun makes us very hyper. And when it's rainy weather, you find that, yeah, people might say you're less productive on the job,
Uh-huh.
because it's almost like as everybody gets
You
in
want to
slow motion.
yes,
Yeah,
yes.
but it's a good way of calming you down and making you feel mellow.
Mm-hmm.
Mellow.
Mm-hmm.
Truly, last week was a big week for us. It was
Yes.
Customer Appreciation Week, and you would have been part of that
Yes.
as an honorary staff, and you would have seen the way people really embraced and appreciated the services, and particularly the activities that we had
Yes.
to really, show our gratefulness, our gratitude.
Gratitude
Yes,
to the
that's the word I wanted to
customers.
use. Yes,
Yes.
our gratitude to our customers.
Mm-hmm, mm-hmm. Carlton, it was indeed a big customer appreciation week from all accounts, from what I saw and from the two events that I was a part of. It seemed to have gone off very well, and I think the customers felt very appreciated. Carlton, to me, the most appreciated customers. Or the customers who were maybe the most appreciative were the kids,
With the children.
because on Saturday at Megaland, the turnout was humongous, and the children who were there had a ball of a time. I can tell you that. I don't even think they wanted to leave at the end of the event. So I don't know. Jolly's seems to have captured all customers, including the children, and I think it was it was a great success. I think you were getting some loyal customers now from early on in the children.
Definitely, that is so true. But I really liked that, and the weather was very, very good to us, a favorable
Yes.
weather, and the children were safe. Their parents felt very comfortable with them, and just looking at children expressing themselves, particularly with the dance and the singing
Yes.
competitions.
Yes. I have to tell the listeners, I mean, if you did not come out to Megaland, you didn't have a child and you didn't come out to Megaland, Carlton Carlton came up with two competitions, I think, that were the highlight of the event. The children, of course, they enjoyed the bouncy castle, they enjoyed the face painting, but when Carlton came out with the dance competition, oh my God.
Yes, you saw all types of things.
I saw all sorts of dancing, and the children couldn't wait to participate. You know, we even had more participants. We had to break it up into rounds.
Yes.
So Carlton, I think if anybody's planning a children's party, they have to hire Carlton Langdo services.
Yeah, that was really good. And really true, we saw the organic talents of children.
Oh, yes,
You saw the
yes,
children
yes.
who may aspire to be the next Celine Dion or
Yes.
the next Elton John.
Mhm.
And you saw the child that may be the next Michael Jackson when it
In
comes
the
to
dance.
dancing. You know, so I think that really ushers well for our culture, the sustainability of our culture. And I think it really means that there needs to be more forum where people can really
Express themselves, yes.
And so I really like that. The VIP shopping experience this year, I liked it because people really took time to interact and to participate in the many services again that were there.
Offered, yeah.
You know, we had counseling, we had a doctor talking about children's health, we had Dr. Lisa Jolly exhibiting the amount of sugar that's in the foods that we're consuming. I personally was quite bewildered by some of the quantities that I saw with some of our favorite foods and drinks. So that really sort of
was an
gave me
eye-opener.
an eye-opener. It was. You know, the artists
Shadrach Button.
Yes, that was well endorsed. I see people really participating in that.
The sip and paint activity.
Yes.
And Carlton also the supermarket sweep, which was held. I think the customers really appreciated that activity, and I think they'll be looking forward to getting the chance to do the supermarket sweep in the future. So it might have to be something that comes back. So not only was there a plethora of information and educational, you know, options for the customers. There was the relaxation aspect of it as well. Of course, there was the massages by beautiful Mrs. Langdo, and the makeup options, you know, to get your face done for the ladies. But there was also that fun aspect with the supermarket sweep, you know, the competitive aspect, customers trying to win top prizes. So, you know, I think it was all encompassing. There was something for everybody at the VIP shopping experience on Friday evening.
So we are hoping that you will certainly participate next year. If God spares, 2024 July. Always remember July is our customer appreciation week, and we normally do it on the third week of July. What we're going to do now, we're going to take a short break, and then we will get into our topic today. And as I did say, it would be a really good time to grab a pen and paper,
take some notes,
as the information that we're going to discuss is very, very vital. Let's take a break.
Up this morning feeling real stink. I had the intentions to call in sick, but I end up in Jolly's pharmacy. Great and down King Street, Jolly's fix up my immune system. Got me feeling fit and strong, now I'm ready to work on the on any mission. If you see me walking, Jolly's pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up your immune system, Jolly's walking. Yeah. Yo, Dominic is the white father box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare. Introducing Jolly's Pharmacy, brand new website, www.jollys.dm. It's your time to jump the line. Shop now at jollys.dm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollys.dm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollys.dm. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. Your one-stop shopping, Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place, happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring papa and mama along. We cater to everyone. What a happy place, happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for discounts. Check us out at the Mega Store in Funkole where there's lots of parking. On Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. And on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
And we are back with you. Of course, this morning, as Carlton has promised, we have a very informative topic lined up, something that you can definitely learn from. Carlton, for me, and it's an interesting topic for me, because, of course, as a consumer of pharmaceuticals or somebody who, uses pharmaceuticals, sometimes I have questions about these pharmaceuticals, and I'm like, I go to Google. but not everybody, maybe would do that. Sometimes this forum, this show that we're doing here, is the perfect time to educate on some of the basic things that maybe people overlook when taking medication or when starting a particular regimen of drugs. A lot of times people have questions they don't want to ask, or they feel shy about asking. I don't know if that is if you experience that a lot in the pharmacy, but I think this is the perfect opportunity for people to learn about some of those drugs and the need to know aspects of taking particular medications.
I'm really liking this, and to begin this discussion, actually, it's to again start with the definition of what is a drug. A drug is any chemical that will alter the normal function of the body. And this is a broad definition that encompasses both herbal and synthetic medications. So whether it's one that has been made in the lab, whether it's one that you pick up on a tree, you just pick some leaves and you draw, you boil, or whatever it is, once it alters the normal function of the body,
it is
considered a drug.
Yes.
Now, a lot of the times, especially right now with the wellness sort of
surging in this interest in wellness,
many people are sort of trying their best to reduce the absorption and the use of synthetic drugs, and are gravitating towards integrative medicine or herbal medicine. But again, these medicines as well alter the normal function of the body, and if they are misused, you can still end up having fragmentation or compromising of your vital organs. And so it is important for you to really listen to basically what we're going to see this morning, as I believe this is very, very crucial. It's very, very important. And a lot of you may be surprised to know you may be affecting how your medication works.
Yes.
Merely because you may be taking them with the wrong foods,
Mm-hmm.
the wrong drinks,
Mm-hmm.
and even at the wrong time.
Right. And
Mhm.
Carlton, that is something I personally worry about at times. So if I'm prescribed something, I worry about, is it going to work effectively? How do I best take this? There is information, of course, on
Mhm.
the label, but you still sometimes have questions. And just to tease you, one of these things that have always kind of perturbed me is when I read on the instructions of a particular medication or drug, do
Mhm.
not consume alcohol or do not take with alcohol.
Mhm.
Then questions start flooding my mind. How much alcohol? When they say don't take with alcohol, how much alcohol is alcohol? Is shandy is shandy allowed? Is a glass of wine allowed? Is if I take it at not the same time I'm taking the medication a few hours later, is that okay? So even with the instructions, it's still
Can
good
be a
to
bit ambiguous.
yes.
Mhm.
So it's still good to have this conversation, so people understand how some of the things, as you mentioned, that we may be eating or doing can interact or affect the efficacy of the drugs that we're taking.
And I'm liking that because you begin with a question that all pharmacists ask almost on a daily basis. Particularly by males, by men. Especially if you dispense in medicine on a weekend
Ah,
or on a festive period.
uh-huh.
Can I have a drink or two with this particular medication? Again, it depends on the drug that has been dispensed.
Okay.
Secondly, it depends on your medical condition. So, for example, if you're diabetic, you went to the doctor, your sugar level has not been doing very well in terms of what it should be, and your medication was changed or altered, or another medicine was added to it, it means already that your glucose level is uncontrolled. Using alcohol with that medication, or after you've taken that medication, or before you take that medication, is already going to compound the situation
Mhm.
and make it worse, because alcohol turns
Sugar.
alcohol turns to sugar.
Sugar.
It's converted into sugar,
Mhm.
and therefore it elevates your glucose level even more. So it depends on the type of medication that is prescribed. For example, if you prescribe an antihistamine, most antihistamines, particularly the antihistamine class 1, um, they are more than likely to get you drowsy. And so alcohol can also
Get
get
you
you
sleepy,
drowsy
yes.
and so forth. So you don't want to compound the two,
Right.
right? There are some medications, particularly with antibiotics, which are used to, one, minimize the multiplication of the bacteria, and also to kill the bacteria. Now, when you do take alcohol with that drug, you are sort of nullifying or decreasing the efficacy of the drug. So you're making the drug actually less effective, because alcohol is metabolized by the liver, but it passes through the GI tract, the stomach, like the very same thing with our medicines, especially oral medicines. And so you are putting, most of these drugs are already broken down by the liver as well. So
Mhm.
using alcohol,
Extra strain.
right,
Mhm.
with the drug is metabolized or broken down by the liver or the kidney. Alcohol now has to be broken down by the liver.
Mhm.
And so you're putting your liver under immense strain, immense pressure. So
Mhm.
these are some of the reasons why alcohol in particular have to be careful. There are some drugs, like for example, metronidazole, or what we call flagyl. Um, that is a drug that, when it is taken, because metronidazole is broken down in the stomach, so when it is metabolized and it combines with alcohol, or alcohol combines with it, you have what we call a disulfiram reaction. So it's a sense like it almost fizzes, like how
Mm.
you'd put in water,
Mhm.
right? Or Alka-Seltzer in water. So when alcohol combines with that drug, metronidazole, a famous antibiotic, antiprotozoan drug, um, it causes that reaction and could cause you to vomit profusely, right? So it could
Okay.
cause you to vomit profusely. There are some medicines as well that can cause GI disturbances, gastrointestinal disturbances, which could result to diarrhea, stomach cramps, and so forth, upset stomach. Using alcohol with that potentially increases these side effects. So the better thing to do if you are prescribed a medicine and you have to weigh, okay, this is the condition that I'm treating. How severe is this condition? How detrimental it is? What are some of the complications that could occur if this condition is not placed under control? And if I were to add or compound it with alcohol, how does it make me better, or will it potentially put me at a greater risk? So that's the kind of conversation you have to have with yourself.
So, Carlton, in terms of food, because we just had a little discussion about alcohol, but in terms of food, what are some of the areas that are of concern or that people need to look out for in terms of consumption of certain food products and a prescribed or an over-the-counter medication they may be taking?
Good question. One, some foods may help with the absorption and metabolism of your medicine. Some foods may reduce or impact or affect the absorption and metabolism of your medicine. Some foods can cause the medicine to stay much longer in your bloodstream, which can cause levels of toxicity to increase, particularly drugs with what we call narrow therapeutic index. And I could explain that. So drugs that basically has a very high, they can get a very high concentration in the bloodstream, and oftentimes they can cause major complications. Okay. Some foods as well can even get us sick when taken, or potentially make the situation even worse when taken with some medications. So that is why it is important when you are receiving your medicines from your pharmacist that you ask questions. But what we see a lot of the times, people are so busy to pick up the medicine without even asking or wanting to get or receive information about the medicine that they are getting. I have had people tell me, oh, I don't have the time, that is too much talk. I've had people,
Wow.
Yeah, I'm telling you, I've had people tell me, oh, they're very busy, or they will Google it. I've had people tell me they know already, and all these things. And a lot of the times when they tell you they know already, sometimes the information or what they say they know is not accurate.
It's not accurate.
It's not accurate. And hence the reason why the professional is available to give you the credible information that may save your life and may at the same time help you. Okay?
Right.
Help you. And that is why we want to advise you on some of these things. We have a caller? Let's take this call. Good morning to you, caller. Thanks for calling.
Hey, Dr. Lando, blessings to you.
Good morning to you, sir. Good morning. Blessings to you too.
Good morning.
Blessings. Young press, what going on?
Good morning. I'm good.
Bless. Carlton, it's very interesting, you know. People does not even know, even if you try to draw it to their attention, how dangerous it is having to do with even taking one drug and taking another drug if the doctor does not tell you to do so. It's like almost like a cross-contamination. Because look at grapefruit. Grapefruit is advised, you should not take certain medicines with grapefruit. And people just say, oh, I know already, some of them foolish pride. I can't read now. Carlton, can you please explain to me? Oh, my reading is limited. Carlton, since I know people used to tell me, oh, you're asking too much questions. And I hear that term, the curiosity kill the cat. I always tell them I'm not a cat. So it is good for the pharmacist to insist at times and say, particularly using your better judgment, you look at the person. It's not about discriminating, okay? It's about looking at the person and say, no, I need to be that responsible. Come, let me explain to you. I will not keep you too long, even if you give them a 10 minutes, you know? And explain to them so you know your conscience is clear if anything goes wrong.
True.
So people should be very careful with those drugs. They figure out, you just pop a pill, man. That is not to go and grate a coconut on a grater, you know. That is not to go and weed with a cutlass. It is easy. You just pop a pill. They say take it 3 times a day, but they tell you take it breakfast, lunch, and dinner. You want, I busy, I just take it anytime. Oh, I'll take 3 one time, man. But we don't even know what we're doing to ourselves, and then we'll blame the drug or the pharmacist. You know, so it's a good thing for you to insist that I need to explain it to you. Although some instructions is written on the bottle, but additionally, I need to tell you something. Wait a while.
Thank you. Thank you, Carla. Thank you so much. And
Yes.
again, he's supporting the view as to why drug therapy education is very, very important. So truly, we on foods. I want to start off with foods, drugs that we should avoid, with foods that are high in fiber.
Okay.
All right.
Or should we avoid foods high in fiber if we take in these
That's
drugs? Right.
That's it. That's
Okay.
it. So we should avoid foods that are high in fiber
if we take in
we're
certain
taking
drugs. Okay.
some of these medicines.
Mhm.
So if you take in the famous glyburide, or it's called Deonil for glucose. For high
Okay.
blood,
So for
right, for
diabetics would be
diabetes.
taking this
And
drug.
that's a very common drug,
Mhm.
glyburide. If you're taking metformin,
That's a very popular drug.
very, very popular drug for diabetes.
Mhm.
If you're taking carbimazepine, which is another name, Tegretol, we use that a lot for bipolar depression, neuralgia, nerve pain, for epilepsy, for depression. We use it for all of that. So if you're taking Tegretol or carbimazepine, again, you cannot take foods high in fiber with this. If you're using the drug digoxin, we use that for congestive heart failure. That too, you cannot take with foods high in fiber. If you're taking amitriptyline, which is a drug that we use for depression, and we also use it as a hypnotic, or if you have almost like a tranquilizer if you have difficulty sleeping, doctors prescribe it for that as well. If you are using these drugs, then taking them with foods that are high in fiber is going to reduce the absorption of these drugs. So these drugs are not going to be absorbed very well. So if you're taking, for example, Tegretol in the morning, you should not take it with, like, let's say, a full bowl of cereal, or just after you've had a bowl of cereal, which may be high in fiber, usually about 6 to 7 grams of fiber per serving.
Mhm.
Or let us say take it with a guava or a roughage, a fruit that is high in fiber, or take it with prunes or raisins, which are high in fiber as well. However, what is recommended, you can take that particular food that is high in fiber at least 2 to 3 hours after you have taken the medicine.
Okay. So that's good information, Carlton. And I will ask you to repeat the list again. But one that you mentioned that stands out, that is very popular, is metformin.
Yes.
Metformin, not only used for if you're diagnosed with diabetes, but a lot of women with PCOS, polycystic ovarian syndrome.
Yes.
Of course, that's my thing that I advocate for awareness for. Because of the insulin resistance indicated in these women, metformin will be prescribed. And I know a lot of women, of course, with polycystic ovarian syndrome, one of the issues is weight gain. That is one of the critical issues with PCOS. And so they may be trying to lose weight, and eating a lot of fibrous foods,
Mhm.
but the doctor has prescribed
Metformin.
metformin.
Mhm.
So what you're saying there is information that is critical, because I know a lot of people on metformin for PCOS, and sometimes they will say they don't like the drug. My gynecologist in particular has told me metformin, the evidence is clear that it is one of the best
That's true.
drugs to prescribe for this,
True.
and it is also not an expensive drug.
Mhm.
So, they will continue to prescribe it. So what you're indicating here is so useful, because people may be prescribed metformin and not know. Once again, as I mentioned, you might be trying to lose weight. So you're eating all what you just mentioned, Carlton. You
Yeah.
you eating Weetabix and your metformin.
That's true.
So that is some critical information. And I never knew that there was an absorption issue here. I just know metformin, for instance, causes gastrointestinal
Right.
discomfort.
Right.
It's a drug I've taken for donkey years,
Yes.
and I know that
Yes.
aspect. So I thought
Particularly
that's
when you just start.
for me straight through.
Yes.
I
Yes.
have been on it for over 12 years,
Yes.
straight through.
Yes.
So much so that I've been prescribed now the slow release.
Yes.
To
Yes. Yes.
offset
Minimum.
that.
Yeah.
Yes. Yeah, but so what you describing there is critical. So I want you to list the drugs again, but the metformin really stood out for me because I know it's a popular drug. Even diabetics and even women, with PCOS who are insulin resistant. So the doctors have prescribed metformin for them.
So if you are on these drugs, you should not take foods that are high in fiber at the same time of having or taking these medicines. The list includes glyburide or Deonil, metformin or glucophage, as it is referred to, amitriptyline, if you're taking amitriptyline, Tegretol or carbamazepine, or if you're taking digoxin. All right. Now, on the other side of metformin, though, if you are using high doses of metformin, so let's say you're taking 1,000 milligrams twice a day or 500 milligrams 3 times a day, and you've been on it for many years, it is important that you take vitamins B12 whilst you are taking the metformin, because what metformin does is that it sort of depletes your body of vitamins B12, and vitamins B12 is very important because it also helps with the stimulation of red blood cells in the bone marrow. If you have a very low level of vitamin B12, you are more likely to develop megaloblastic anemia. And so it is important for you to take vitamins B12 whilst you are on metformin, if you're taking metformin.
That's critical information. Carlton, once again, I found this out just through, I was reading something and I found this out, and I had already been on metformin for years. No physician had said that to me. So I just started to take B12 because of what I had read. But what you're saying there, some people may not have heard before. So this is good information to note down or to take note of, and vitamin B12, of course, you can easily purchase and supplement, with B12. And it's interesting, Carlton, the discussion we have in this morning is one that maybe the doctor who is prescribing the medication for you should maybe have that discussion with you, but for whatever reason, or time is often one of them, the doctor is trying to get you in and out, maybe would not have had that discussion with you. So you there taking a drug and you're unaware of some of those things.
That's
so
true.
This information is so crucial, for people who have been prescribed these drugs, who have been taking these drugs, as you said, for years, and maybe not aware of this information.
Okay, so we're going to look at dairy products.
Okay.
Right? If
That's a favorite for a lot of people.
If you are taking certain medications, they cannot be taken together with dairy products. And we talk about dairy products: milk, cheese, ice cream,
yogurt.
Yes, and many of us like
love
ice cream.
and love yogurt too.
And yop would be included in there as well. So if you are taking the quinolones, and that's a particular class of antibiotics. So if you're taking drugs like ciprofloxacin or norfloxacin or levofloxacin, if you are on these drugs, you should not take dairy products together with it. If you're taking iron, whether it's an iron pills, iron tablets, or a tonic with that's high in iron like IFA or Ionom, that too. If you're taking thyroid medications like levothyroxine, if you're taking tetracycline or doxycycline or minocycline, we call them the tetracyclines. If you're on this particular class of antibiotics, if you're taking the macrolides, such as that azithromycin or erythromycin, or
That's
what we call
antibiotics
Citromax,
again. Mhm.
right? That's another class of antibiotic. These, all of those would actually reduce the absorption of these drugs. So when they combine with dairy, then you have a competition as to which one that will compete. And what happens, dairy now delays the absorption of these drugs, and these drugs don't work very well. And they often give rise to diarrhea because already dairy, when it's taken as lactose and then it turns to lactic acid. And so if you have lactic acid plus hydrochloric acid, you are more than likely to end up having a reaction that could result in diarrhea and upset stomach. So if you're taking iron preparation, levothyroxine, tetracycline, doxycycline, erythromycin, azithromycin, or Zitromax, if you're taking iron preparation, if you're taking Cipro, if you're taking these drugs, then you should not take them together with dairy products. Again, if you have to use a dairy product, it will have to be at least 2 hours before or 2 hours after you
Take
have
the drug.
taken the medication.
Okay. So the timing is also important, in when you take
The
these
timing is
foods.
important. The other thing too, if you are using iron preparations, it is best that you take it with a citrus drink. Yes. Citrus, which contains high levels of vitamin C, helps with the absorption of iron. So if you're taking vitamin C, or if you don't have citrus, you take a vitamin C tablet along, or chewable tablet, or whatever way you have it, along with your iron pills or iron tonic, then it's going to help with the absorption of the iron. So it's going to let the iron get to its highest peak in the blood. So that would be a good thing for you. Okay. So you wanted I want to mention that as well. I suspect we have a caller.
We have a caller.
Good morning to you, caller. Thanks for calling.
Good morning, Mr. Landon.
Good morning to you, ma'am.
Yeah, there's a drug on the market called Galveston. That's for diabetes also. So
Yes.
what are the side effects? Because I noticed some people take it and they have an upset stomach. It interferes with your bowel movement.
Yeah, because it contains metformin.
It what?
It contains metformin.
I know it does.
Right. So because it contains the metformin, it gives the diarrhea and the upset stomach and all of that, because it is metabolized or broken down by the GI tract in the stomach.
Okay, because it's taken twice a day. But
Yes.
it has another name, Valdamet or whatever.
Yes.
But the real name I saw is Galveston.
Yes. Yes.
So I was wondering what were the drastic side effects,
So
if any.
that's what it is. So it could more or less cause irritation of the lining of the stomach, giving rise to diarrhea. In cases like that, sometimes what we do is, again, that's why the fiber products should not be taken together with it, because fiber acts as a bulk forming laxative. So fiber itself can cause you to go to the bathroom. So using fiber together with this drug can potentially gives you a serious diarrhea. So you don't want that to happen.
So you could take it 2 hours or 3 hours after you have taken the drug?
That's fiber.
Yes.
Yes, you can, if you have to take fiber. Yes.
Okay then.
Okay.
Thank you very much.
Have a good morning.
Yeah, have a blessed day. Thank you.
Yes.
Yes.
Trudy, we are on to the famous grapefruit juice.
Blessings mentioned it earlier.
The famous grapefruit juice. I am a big fan of grapefruit juice.
You like grapefruit
I
juice?
love when the Creole season comes and all the citrus are in.
Yeah.
I love
Christmas
grapefruit juice.
time.
It's one of my favorite juice, especially when I put a little almond essence in that. I really love that. But grapefruit juice has it impacts the way that many medicines work, because of a molecule that it releases by the liver, and that molecule competes with some of these drugs, and they cause these drugs to linger longer in the bloodstream,
Okay.
which creates the potential for toxicity.
Toxicity.
So, for example, you are taking
I know the statin.
nifedipine,
Okay.
or you're taking Zocor, Crestor, one of these drugs, atorvastatin. So you're taking that for your cholesterol. You might be taking 40 milligrams, which is a very high dose, and you take that one pill at bedtime. Now, that one pill normally have what we call a half-life of 12 hours. So it normally could stay in your bloodstream for about 12 hours. If, let us say, at the same time you've taken that, and some people don't like to take medicine with water because they don't like water, so they might decide, I'm going to drink grapefruit juice
with the
instead,
medication,
to throw that down my throat. And you decide you drink one glass and the juice is real nice, you drink another glass. You are actually really creating the potential for toxicity
in the
so
blood.
what would happen is that the drug is going to linger beyond the 12 hours in your body. So time you take the next dose, you have a high
multiplied
concentration
effect,
of that drug still in your body, which can cause major problems.
Yeah, that's the first time I started to hear about grapefruit juice and that implication you mentioned was for those statin drugs.
Yes.
And then I also noticed a lot of people are prescribed statins, for cholesterol management. So I think, this information once again is something that is applicable to a lot of people because of that particular category of drug that seems to be very popularly prescribed.
Yes.
Yeah.
Yes. If you are taking calcium channel blockers, and those are medicines that are widely used in the control of high blood pressure.
Okay.
So if you're taking drugs like nifedipine, amlodipine, cardidipine, all of those normally they end with a pin. If you're taking these drugs, again, you want to avoid
grapefruit juice.
Taking it with grapefruit juice. If you're taking the benzodiazepines like diazepam, lorazepam, clonazepam, alprazolam, if you're taking these drugs, we use them for anxiety, we use them for insomnia. These drugs as well, and not just a matter of they can cause dependency, they can cause you to get addicted to them. These drugs, if they are misused, and I want to say that, they can also impact your memory. They can cause you to begin to lose your memory. So that is why they are not used for long periods of time.
Okay.
Right? So sometimes you find people, I've seen cases where prescriptions are written very erroneously, where, dispense 100 Valiums, or that is crazy. That can be crazy. So the recipient feels that it's a good thing because maybe they suffer with anxiety bad, or maybe they have chronic insomnia and they cannot sleep. But in a case like that, we would refer the person should be referred to the psychiatrist in a case like that. So if the general practitioner cannot seem to be able to manage the situation, they should refer the person
to a psychiatrist. Okay.
Because these drugs, they have to be closely monitored. And from a medical standpoint, a lot of people don't recognize that. But sometimes the pharmacist may not dispense the full lot of the drug based on the clinical symptoms and the diagnosis that is made. So, for example, somebody may have a diagnosis of bipolar type 1, which is manic, right? Manic depression, where that person is what we call cycling. That person not sleeping, they hyper, they breaking up things, they walking on the road naked, they in that phase. Now, giving them a large amount of benzodiazepine to go home, you may potentially put that person at risk because that person might decide to take all of the drug as an overdose. You understand? And so we have to protect the client as well.
Okay, so
I've
you would
had
not
people-
dispense the entire
I've had
prescription.
People, I've had people make noise. I've had people curse me. I've had people do all kind of things because they did not agree that with the amount that we were dispensing at that time. But all of these we have to take into consideration when these drugs are dispensed. And a lot of the times, again, people don't know the rationale. And even sometimes you try to rationalize it to them, they sometimes still argue. All right?
But yeah, that it's the precaution is necessary.
Better than the cure.
Right.
It's way better than the cure. You know, if you're using clopidogrel, which is Plavex, as a blood thinner, this one too, you want to avoid grapefruit juice. Most of the anti-neoplastic drugs or cancer drugs that is been prescribed by the oncologist, you should not take them with grapefruit juice. If you're taking the cough suppressant, dextromethorphan, that one too, if you're taking that cough suppressants, and you normally find that active ingredient in the DM. So if you see the cough medicine ending with the prefix DM,
the suffix
the abbreviation,
DM.
it normally means that active ingredient. It's a short for dextromethorphan. So that's what the DM means.
Okay.
In there.
And so I'm sure, the listeners, you might have seen it in an over-the-counter cough syrup, something DM.
Yes.
Yeah.
So if you're taking a cough medicine with that active ingredient, then you should not take it with grapefruit juice. If you see a cough and cold medicine with DC, it means that it contains a decongestant.
Okay.
Or you may see PC, it means that it contains pseudoephedrine.
Okay.
All right, which is a decongestant. If you see EX, it means that it's an expectorant.
Okay.
All right, so these abbreviations, they are there for a purpose. And when you see them, they basically, so the DM means it's a cough suppressant.
And suppressant
the EX means it's an expectorant. The PC means that it contains a pseudoephedrine, which is a decongestant.
Okay.
All right.
And even those terms sometimes, Carlton, people mix up. So you take a suppressant if you want to not cough, you want the cough to subside, and expectorant if you want to cough to bring up the mucus which is on the chest, and a decongestant if you feel if you feel your chesty or your lot of mucus on your chest and you want that to be broken up. So even those terms, and it's interesting that you're pointing that out because of course these cough medications and the one you mentioned, and so if you're looking for something and it has DM, Carlton, you mentioned this is over the counter stuff. So you would not maybe you think you would have to talk to a pharmacist about what you should and shouldn't take with it, and sometimes people don't even read the fine print on those over the counter drugs.
You're very correct.
Yeah.
Because even with pseudoephedrine, which is a decongestant, you have to be very cautious using it if you have prostate cancer or enlargement of the prostate, and if you have glaucoma.
Wow.
As well.
Okay.
Because it can also increase the pressure the same way that it can increase your blood pressure, it can increase the pressure of the eye as well if you have glaucoma.
Okay.
Right. So we want people to be, and that is why if you are selecting an over-the-counter preparation and you may have some concerns or inquiries, it is always best to seek the advice of the pharmacist.
Yeah, and I can attest to the fact that at Jolly's, the pharmacists are very willing to provide that assistance. Yesterday, I was looking for an over-the-counter cough and cold medication, and I was at Mega, and Ryan Samuel assisted me, so I'll mention his name. So if you have chronic conditions or if you want other drugs as well, before you just pick up an over-the-counter drug, you should consult and ask the pharmacist will be more than willing to help you. Of course, if you enjoy this pharmacy, more than willing to help you with what is the best choice, because you may pick up something that is really not, suitable for your particular set of conditions.
And that's a good point that you've raised, because there are 4 groups of people that you really want to be extremely cautious when you are purchasing medicines for them. 1, babies and toddlers, children below the age of 12, we normally say, the elderly, right? People with chronic non-communicable diseases as well. You want to be very, very careful with the type of medicine. Sometimes your family sends something, a barrel, and they put some OTCs. Before you actually use them, seek the advice from your pharmacist. Good morning to you, caller. Thanks for calling.
Morning, Carson, and to Trudy.
Morning.
Good morning to you, sir. Good morning.
Carson, I have a question I'd like to throw in the mix of your prescription drugs, how you prescribe the taking of certain ones. But I've noticed there are a lot of people in the Black community in the United States, and I'm pretty sure it's widespread because it seems to be something that is more prevalent in African people, Black folks. The kidney problem, and from what I'm hearing, a lot of it is contributed to certain prescription drugs, and not only prescription drugs. I think diet is also a problem. So I'd like to see if you could talk about that in your prescribing, how it's taken, what it's taken with, or if you find there is an issue with what I just raised. I'm listening, my brother. Thanks.
Thank you. And that's a good question. With kidney failure, you don't just get up unless you have a kidney that has been congenitally, you were born with a defect, you were born with that congenital kidney failure. But if you've not born with congenital kidney failure, what generally causes kidney failure, from what our statistics are showing in Dominica, is 1, uncontrolled high blood pressure, uncontrolled glucose levels or diabetes. Lupus. People with lupus are more likely to end up having kidney failure as well because of the type of condition it is, and medications. People who are on polypharmacy, so people who might be using 10 to 12 medicines, they too are more at risk to kidney failure, particularly if kidney function tests are not frequently done. But I know that most of the doctors would be doing those tests with patients, particularly if there are medicines or there are many medicines from that listing that is broken down by the kidney. And so liver function tests would have to be done kidney function tests would have to be done quite, at least 2 to 3 times a year, just to make sure everything is functioning well. But oftentimes what we see happening is that the blood vessels get damaged because of too much glucose in the bloodstream. And if the blood pressure gets too high as well, it damages blood vessels too in the kidneys and subsequently develop end-stage kidney failure. And so hence the reason why adhering to medications, modifying lifestyles, avoiding smoking and the abuse of alcohol and other narcotics, that is why these are so important. Monitoring your weight, because if you are obese, you are more than likely as well to end up having circulatory problems, fluid retention, and which could also potentially cause issues with your kidneys. So, this is a good point that you've raised. Again, we in the Black community, we love soul food. We love to have our potato salad and our big foods and our pig snout and our smoked meats, and we love salt, we love sugar, and it's a fact. And this is the two main ingredients that is really causing us to go to our graves prematurely. And so we have to now begin to sort of reset and make wiser choices in terms of, what is healthy and what isn't healthy, and how some of the habits that we have is impacting our general health and wellness. Let's take this caller. Good morning to you, caller. Thanks for holding.
Just out of curiosity and my own enlightenment, all right? I want to engage quickly. Carlton, in America, infant mortality rate among African people, and not poor African people, rich African people, it's alarming. Carlton, it's a serious conspiracy. I was watching during COVID-19. There was a hand sanitizer machine. So then they were showing you what they call white people and what they call black people. I do not subscribe to those descriptions. A white person put their hand under it, it serves them. More than once, and when a black person put their hand, it is not serving them. Can you imagine the advancement in technologies, Carlton? So now medicines can be made through the whole research. It is patterned on white people, and it is not as effective. And I not only to social media, Carlton. I am telling you what the mainstream media is reporting, just like the infant mortality rate among African Americans, Carlton. And medicine that is ineffective for African people, African American, and quite effective for the white people. So in this day and age, people have to be less lazy, dig deeper, pile higher, ask no question. The same thing we said earlier on. Try to know what is applicable, what is workable for you, rather than you say, okay, well, the pharmacy was trying to explain, but they tell me take 1 3 times a day, and that's about it. But the pharmacy has something else to tell you. It may be the pharmacist's personal opinion, and what he may not be able to write for you, and many, many, many things fitting in the equation where people should be very careful because it's a very diabolic world.
Thank you, caller. Thank you. Trudy, we have to watch the time. So let's see if we can go to the next one. So we were saying drugs that interact with grapefruit juice. We spoke about the statin drugs, drugs that are normally used to control cholesterol. We talk about the calcium channel blockers, drugs that are often used to control blood pressure, like amlodipine, nifedipine, diltiazem, verapamil, all of these. The benzodiazepines, which contains which basically would be Valium, diazepam, lorazepam, alprazolam, all of these. Clopidogrel, which is normally Plavix. If you're on cancer medications, if you're on dextromethorphan, which is a cough suppressant, domperidone, which is often used for gastric issues, or what we call peristalsis. It helps with help your food digest better. So if you have a lot of bloating where the food is not digesting, we normally use domperidone for that. That drug too should not be taken with grapefruit juice. Tamsulosin, that is a drug. Flomax, we use that for prostate issues. That drug should not be taken with grapefruit juice. If you're using Viagra or Cialis, they should not be taken with grapefruit juice. Okay, so
Yes.
we are going to talk about caffeine.
Yeah.
Coffee.
Yeah, and Carlton, you mentioned earlier, if somebody, doesn't like drinking water and they may be taking their medication and, throwing back grapefruit juice to take it, I've seen
no-no.
people throwing back coffee.
Yes.
And of course, if the medication is prescribed and you have to take it first thing in the morning, coffee is often what people are drinking first thing in the morning. So what do you have to say about coffee and its interaction with some drugs?
Yeah, there's so much talk about coffee. Coffee is an excellent antioxidant. Coffee is very good for brain stimulation in terms of keeping you awake. There are some benefits of coffee. However, it is a stimulant. Coffee contains a chemical called tannins, and these chemicals basically they bind to certain medications, therefore decreasing how the medication is absorbed in the body. So these chemicals, tannins, when they bind with with your medications or the particular medication, they affect how these medicines work. And I know that many of us drink coffee. Well, I don't do coffee because it gives me palpitations, but I love the smell of coffee. But many people do coffee, drink coffee, even on the workplace, how many of them multiple times a day.
I notice a lot of gym people are relying on coffee or caffeinated products.
Right.
Yes, I notice that's a big thing for the guys.
As a stimulant.
In the
If
gym.
you're studying, that's another time.
Oh, yes. People who want to stay up late.
Caffeine. Sometimes people use caffeine as well for the control of what we call vascular headaches. So if you have a vascular headache, like a migraine headache, sometimes we use caffeine as well to help to control and to minimize the frequency of the headache. But if you're taking most anti-diabetic medications, you should not take them together with coffee. If you're taking theophylline, that is a drug we use for asthma. It's a bronchodilator. So if you're taking theophylline, you should not take it with coffee. If you're taking anticoagulants, these are medicines that helps to break down clots, so they help to thin the blood. You should not take coffee together with them. If you're taking the tricyclic antidepressants like amitriptyline, you should not take coffee together with it. Asthma medications, and that includes your inhalers, you should not take coffee with them, because as asthma, coffee can actually precipitate an asthmatic attack. All right. Contraceptives, if you're taking birth controls in tablet form and in patches, even in injections, if you've taken your injection on that same day, you should avoid drinking coffee together with it. If you are using ephedrine, so even the pseudoephedrine in the cough and cold medicines, or your blood pressure was very, very low, you went to the hospital, they inject you with ephedrine to bring back up the blood pressure, then you cannot take coffee together with it. In some cases, in most cases, coffee increases blood pressure. So in people who have uncontrolled high blood pressure, they should not be drinking coffee, or they should not be taking products that contain caffeine. And when you buy the products, always look, because sometimes they put caffeine in there as a stimulant. All right. Even in some medicines that control appetites and help with alertness, they put caffeine in there. So you want to be careful with that. Okay. Green leafy vegetables. Well, most of us know, if you are using anticoagulants or blood thinners basically helps to reduce vitamins K in the blood, and vitamins K is used to help clots. And so you want the opposite. And foods that are rich in in B12, or foods that are rich in green leafy vegetables, they generally help. Contains a lot of vitamins. They contain vitamin K, and
Okay.
so if you're using warfarin, you're using
Heparin.
heparin, you're using enoxaparin, you're using all of these to help with blood clots, you should avoid using uh, green leafy vegetables like kale, spinach, broccoli. All right, these foods can definitely cause more complications for you. If you are using AC inhibitors, so you're using drugs, the AC inhibitors are drugs used that to control blood pressure. So things like captopril, lisinopril, enalapril, we use it for cardiac arrhythmias as well. So if you're using these drugs, you should not take foods that are rich in potassium. So you
Like your
should,
bananas.
yeah, like bananas,
Okay.
coconut water, pumpkin, pumpkin
Okay.
juice. Pumpkin is very rich in potassium. These foods, and even nuts as well. These foods, if they are taken at the same time with this drug, they can actually cause cardiac arrhythmias. So they can cause your heart, they can
Irregular
cause a
heart-
bit of what you call
heartbeat.
tachycardia. So they can cause your heart to beat
Speed up.
and start beating very fast. So if you are taking AC inhibitors, again, captopril, lisinopril, enalapril, these types of drugs, if you are to use a food that is high in potassium, you will have to use it at least 3 hours after you have taken your medication.
Carlton, let me ask you, what about if somebody is supplementing their diet with a supplement that includes potassium? So you're taking one of those some sort of supplement that has, minerals and vitamins included, and potassium being one of it. Is that something that they should cease from doing if they're taking an ACE inhibitor?
It depends on the milligram,
The
micrograms,
quantity of, okay.
More, it depends on that.
Okay.
And so if you do have one that has, let's say you're on an AC inhibitor and you're using a multivitamins with potassium, then you want to maybe let us look at it. If you are using potassium for another reason, let's say 600 micrograms of potassium, you're using that, and you are on an AC inhibitor, that is something that is contraindicated, and that is something that would have to be closely monitored and looked at. Because sometimes we see things like that as pharmacists, and we intercept these things, and we call the doctor, we call the prescriber and say, hey, I recognize that this patient is on an AC inhibitor. Sometimes they might be taking it multiple times a day, and yet still they're on potassium. What's up with that? How can we, so this is some of the things that pharmacists do, and we look for.
And sometimes because
Drug
there's and they
interactions.
call that what you call it, continuity in healthcare. So sometimes if the one doctor maybe had prescribed the ACE inhibitor, and another doctor maybe had told the patient they needed potassium, and the two they don't know. So that's why the pharmacist is important in that regard, because then you would catch something like that.
And that is really, really important. A lot of the calcium channel blockers, we mentioned them earlier on, nifedipine, amlodipine, which is very, very popular.
Yes.
We should not take them with fruit juices. So besides just the grapefruit and dairy products, we should not take them with no juice, no type of juice together with them. So we should just take water with them. And if you are on a calcium channel blocker, particularly amlodipine, and you recognize that your ankles are always swollen, that is something that you should notify your doctor about. All right, you should notify your doctor about that. That is a very common complication of amlodipine in particular. And if you see that happening, let your doctor know. They can always take you out from amlodipine and put
try
you
something
on another
else.
calcium channel blocker. Okay. Foods that are high in protein. So if you have kidney failure, or your kidneys are compromising, your doctor will tell you have to reduce foods that are high in protein, because protein is broken down by the kidney. So the kidney is the organ that breaks down protein. And so if the kidney is already compromising, you don't want to give it much work, plenty work to do, or additional work to do that could even make it more compromised. I see we have a caller. Let's take this caller. Good morning to you, caller.
Hello, good morning, Mr. Carlton.
Yes, good morning.
I would like to know if you are taking warm lemon water in the morning, can you take pressure medication after that?
Well, no. So if you're taking warm lemon water in the morning, you'd have to take it at least 1 hour before you take your medicine. Okay? At least 1 hour before you take your medicine. So I was saying about foods that are high in protein, and people with kidney failure, or people with kidney failure, should be using foods that are low in potassium and foods that are low in magnesium. So people with kidney failure cannot just go and eat how many bananas, right? Because it's very rich in potassium, or drink a full bottle of coconut water. All right, so you want to be cognizant of that. And I know that most of the patients who go to the dialysis unit, they are told these things. Sometimes people cheat, and then they suffer the consequences of it. But you cannot have too much banana. You cannot have too much coconut water and cane juice as well. All right. There is another type of food called the tyramine foods. And the tyramine foods, tyramine is a normal substance in the body. But these foods, they can be potentially troublesome for people who suffer with gout, which is a type of arthritis,
yes.
and people who suffer with migraine. All right.
So tyramine is an amino acid. So it's one of the building blocks of proteins. So people, particularly with gout, they have to look at the quantity of that in their diet. And gout predominant in men. Yes. And the big toe is what is affected. But yes, I know the diet has to be restricted for that particular amino acid if you suffer from gout.
And I thank God I don't suffer with gout.
Yeah, some of the foods that you like, and the what you call it, the seafood, the shellfish, shellfish, like shrimp,
cheese, coffee, chocolate, red wine, smoked meats, cured meats like salami, hot dogs, sausages, olive, soy products, ripe bananas, pineapples, avocado, nuts, all of these, the shellfish, all of these, they are very rich in tyramine, and they can increase the levels in your blood. They would increase what we call purine, and therefore would cause you to have acute gout. So you could end up having serious pain, and they could also cause you to have acute migraine headaches. So that's why you are told to avoid eating these foods whilst you are on this medication, or if you're suffering with these medical conditions. Trudy, we are out of time. I recognize it was a very, very useful and informative discussion that we had today. I do hope that listeners took note. They can feel free to call us at Jolly's. We will try to have that information on our Facebook page so that you'll be able to have access to it. And we do pray and hope that you will take all of the necessary advice that we've given to you and make wiser choices. So, from all of us here, it is time for us to leave the studio for the next program. It was a pleasure being here with you today as we discussed common medicines and food interactions. As usual, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and remainder of the week. Take care, everybody. Bye-bye.
Goodbye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in.